Let's talk about healthcare today. As an early retiree, healthcare is a big deal for me. I'm retiring at 52, and I have a bridge from 52 to 65 before Medicare kicks in. It's got me extremely nervous. But as long as we work in our plan, I think we'll be okay. Let's talk about that today. So, I'm Justin from Salty Retirement, and I plan on retiring this year and working possibly remotely, maybe some consulting work. But for now, the goal is retire. Everything adds up on paper that I can retire. I can move on, I can start over, I can do whatever I want. We're debt free, we don't have any big lingering bills, and we did well when we sold the company. But, you know, going into healthcare is a big deal. I've been fortunate that, me running my company, I was able to have great healthcare and provide healthcare for all my employees 100%. They never had to pay a dime. And, going into retirement, I'd never had to come out of pocket for healthcare. And, so, you start looking at the ACA and you start realizing there's certain thresholds that you got to be under to make ACA affordable. I don't understand that. Affordable healthcare is supposed to be affordable. And for a 52-year-old, healthy, non-smoking male, same with my wife, very athletic, very healthy. I mean, there's a possibility we could be at $2,000 a month. We've gotten quotes recently from, this all depends on your income, by the way. So if let's just use an easy number. I don't know the number right off the top of my head, but I know that if you're under 80,000 of your MAGI, which is modified adjusted gross income, that you're going to get a pretty good deal. And there's this whole thing on healthcare.gov that tells you about your numbers, your $80,000. If you're below a poverty level, I believe it's 400% or something. I can't remember off the top of my head, but out of all those numbers, I do know my numbers. And my numbers currently right now range anywhere from $500 a month to approximately $2,000 a month, which is kind of scary. You work your whole life and you get the opportunity to retire early, and you realize your health care is probably going to be one of the biggest boogers out of everything. And we take care of ourselves. I'm out here walking right now in National Forest, doing a couple of videos out here. I'll be heading to Florida next week, but you realize that, your healthcare is going to be the booger of all things. It's already expensive. I don't care what anybody says, it's expensive. We have an HSA plan currently, and we spend out of pocket. I'm going through my old man phase where I want to get my hearing checked, and that's a $200 bill, no matter what you look at. It is what it is. And they spent 10 minutes with me for $200, and that's kind of high, to be honest with you. I get it. People got to make a living, but I'm sure there's a whole lot more lawyers and insurance and things like that involved that make it more expensive than it actually should be. I don't want to get into politics right now, but it's a terrible program. It should be based on your age. It should also be based on how healthy you are. And it's kind of like auto insurance. As you get older, you should be able to get some discounts if you're healthy, I think. I don't know. I'm not a politician and I'm not making decisions. But the decisions we got right now on healthcare is pretty bad. I couldn't imagine. I'm fortunate to be in the position that I can retire early. But I look at some people that I know, not early retirees, but people coming up on retirement that are, close to me and, some of my employees and things like that. And, they'll be on Medicare and things like that, but it's still expensive. You know, they're not getting free health care anymore through their company, through me. So they're going to take on this burden that they're not expecting. And healthcare sucks. You know, there's no way you can look at it. One, nobody wants to deal with healthcare. Two, it's expensive. And three, it's a never-ending process. You know, I see my family, my parents, go through healthcare issues, and it's a constant conveyor belt of going to the doctor. I mean, I think my parents go to the doctor 2 to 3 times a week for something. It might be a checkup, it might be an MRI on something. You know, they've got some healthcare issues, and they're just constantly testing them, but never doing anything. And I know they're older, and you know, it's kind of one of those things where you start realizing the older people get, the healthcare can't be fixed sometimes, or healthcare can't fix things. And it's a scary thing. You know, my parents are in their late 70s, and it's one of those things where they're just constantly going to the doctor, and that's a fear that I have going into early retirement, because you got this crazy bridge, you know, from 52 to 65 is 13 years. If I'm paying $2,000 a month, that's a lot of money. And you know, hopefully it's not. You know, right now we have some, I think that's one of the things about a financial planner. I've said it in other videos how they suck, but maybe they can help me with tax preparation to get your taxes down so your MAGI's lower, and you can take advantage of it, you know. But a lot of people don't have that option. You know, they're living on Social Security, or they're retiring early with, you know, small pensions or big pensions or whatever. But healthcare is an issue. You know, people got to realize that, and I don't know how to fix it. I just, when I hear these politicians talk about healthcare being affordable, I just don't think that they're out there buying it, or they're really good at selling the farm or something. I don't get it, because it's maddening that you can't afford health care even if you're wealthy. I mean, you know, and the same thing if you're in middle retirement, or if you're in lower retirement, or, you know, if you're just on Social Security. You know, there's ways of making it better, but I just wish they would work on making healthcare cost cheaper, not making health insurance cheaper, because it doesn't work. You know, if I could go into a place, I watched all these videos and things like that, but if I could go into a place like Mexico and, you know, get something done for 1/10 of what we do it in the States. And I feel like in this day and age, there's people in this world that are just as smart in Mexico. You know, I don't know where the stigma of healthcare being different, unless it's a resource thing. But I probably would trust somebody in Mexico just as much as I would in the United States. I mean, a lot of our doctors are, you know, immigrants that came to school here, or were school over there and came over here and learned as well, and they worked their you-know-what's off to get here. But you know, at the same time, it's not working for everybody. And there's no, you know, I'm a very conservative person when it comes to money. But I also think that, you know, there's got to be a fix somewhere. And right now, nobody's fixing anything. They're just pointing the fingers these days. And you realize that, you know, healthcare is probably the least of anybody's worries in politics. So anyway, if you got any comments on that, please leave it in the comments. I'll read them. And also, if you like it, like the videos that I'm doing, like and subscribe. All that stuff everybody says. Like I said, I don't know what they say. I can't ever remember it. But if you like it, take the time to subscribe and all that stuff, and I'll catch you on the next one. Again, healthcare sucks. Just realize that it's expensive in early retirement.